Now, today is Rare Disease Day. It marks the global movement towards equity in opportunities in healthcare. It also seeks to grant access to diagnosis and therapies for people living with rare conditions. Now, according to Rare Disease South Africa, 1 in 5 South Africans is affected. Let's speak to Monique Nel, from Rare Disease Medical Advisor at Sanofi. Monique, good morning. Thank you very much for your time. Talk to us about the significance of this day holistically.
Yes, thank you for the opportunity. Yes, so there's no two ways about it. If a patient is living with a rare disease, their entire lives and their health are significantly impacted. So from a debilitating sickness, but there's all the other aspects that is not always visible. We look at emotional aspects, social challenges for these patients, but also their families as well as their caregivers. So there's many challenges that they have to face on a daily basis. And I think we're only touching the iceberg here.
And then which are the commonly known rare diseases?
Oh, there's really so many diseases. If we can maybe just highlight a few where Sanofi is more involved in is our metabolic storing conditions, where we've got Gaucher disease, mucopolysaccharidosis, especially mucopolysaccharidosis 2, seems to be a disease that is quite prevalent in our country. There's also the Crohn's disease or the muscle dystrophy diseases that is quite prevalent in South Africa.
And then if we talk diagnosis, one can assume it would be a long and financially taxing journey before one can get some sort of an accurate diagnosis of a rare disease. What work has been done to improve just that experience of getting an accurate diagnosis?
You're touching a very sensitive point there, because some of these patients, their delay in diagnosis is up to 10 years, which includes so many hospital visits and specialist visits. But I think the mammoth task here is that we've got 7,000 different rare diseases. And again, it comes down to awareness about these diseases and education about these diseases, because you cannot diagnose something if you don't know about it. So the continuous studying and giving opportunities to our healthcare sector to improve the education about these diseases is a critical aspect. The second thing is also diagnosis, because if we don't have the diagnostic capabilities in our country, we cannot diagnose these patients. And of course, if diagnostic testing is available, it comes at a very high price. And we don't see that our funders is coming to the party to really reimburse these type of testing and monitoring tools for our patients.
So at the very least, because when you're speaking, I'm already thinking about the public health system. It's got its own challenges. And now if we have to even add, and its challenges with regards to the common diseases, now how much more of a challenge would it be to assist in rare disease patients? So with that said, what would be perhaps the low-hanging fruits if perhaps the state were to come to the party? What would perhaps be the 3 that they need to be focused on insofar as dealing or assisting with this fight to deal with rare disease?
So there's an ongoing movement currently to work on a rare disease policy, which will actually become the cornerstone of improving everything with regards to rare diseases in our country. And the task team behind this policy is really Kelly from the Rare Disease Society. And this policy will then focus on a lot of aspects when it comes to rare diseases. It's about education and then access to information for these patients. But more importantly, is access to optimal care for these patients in our hospitals and access to the right medication at the right time, making sure that there's not a delay from diagnosis onto treatment, because that is also another aspect where patients deteriorate. We see their health deteriorate, and sometimes time is not on their side.